Up next, we have Molly Tavella, MPH. She's the Shearer Student Fellow at Physicians for a National Health Program, and she's going to discuss how to advocate for and work on universal health care as a pre-med or pre-public health student. Without further ado, let me introduce Molly Tavella.
So like he said, I'm Molly. I just got my MPH actually at UC Davis. It was really cool and fun. I learned a lot. So I work for Physicians for a National Health Program, PNHP California, and I'm the Shearer Student Fellow. This is a rotating fellowship. Graduate students and medical students are eligible to take a year off and work with PNHP. But really, I'm here to talk to you about CAPSA. I'm a liaison for CAPSA, the California Health Professional Student Alliance. And both of these organizations have just one goal. We believe that healthcare is a right, and so we want universal healthcare. We want single-payer healthcare. I'm going to use those terms interchangeably. But what I really want you guys to focus on is publicly funded, privately delivered care. So really what we're talking about is a change in the economics, a change in the financing system of our healthcare system. So really as a patient and as a provider, it's not going to look too much different with the way that you deliver care, because it's still privately delivered. This workshop is how to work on universal health care. So first, in order to work on it, you need to understand it, what it is, and the system also, you need to understand the system that we have right now and how they're different. And then we can kind of go into more concrete things of what you can do to work on it. Okay, so single payer or universal health care. What are the goals? Well, first goal, universal. We want everyone to have health care, no matter who you are or where you come from or how much money you have. We believe that you should have access to health care. And notice I didn't say health insurance, right? So having health insurance and having access to health care, they're not the same thing, unfortunately, in this country. And we believe that this care should be comprehensive. So any necessary care that you need within reason, you should have access to. We also believe that care should be continuous, so portable or attached to you. So not your job, not your spouse, not your parents, not your school, because none of those things are guaranteed for your life. Also, we think that the healthcare should be fair. Everyone should have the same care available to them. And it should be affordable, and affordable over a long period of time, so sustainable. So just to give you a picture again, this is the current financing system. I don't like looking at it. It actually makes me kind of go cross-eyed. It's very complicated. Our funding streams, we have a bunch of different funding streams that we use to pay for our healthcare in this country. So single payer looks more like this. So what we have is we take the public money that we're spending on programs like Medicare, Medi-Cal, VA, other programs. Also an employer payroll tax and income tax. And by the way, these taxes would replace your premiums, your co-pays, and your deductibles. So it would stop all of your cost sharing. You take all of this money, you put it towards one single payer, and that single payer would allocate those funds to prescriptions, to your physicians, to other health facilities, hospitals. Okay, so pop quiz. Now I know you guys didn't know there was going to be a pop quiz, but we'll go easy on you. So how many of you guys are disappointed that we didn't get the public option with our new healthcare reform? Raise your hand. Okay, so I know that you guys have good intentions. If you did want the public option, because really the public option, if the public option was the only system delivering healthcare, well, that would be single payer. But the public option, when it's in this, when it would be with the systems, the other healthcare payers that we have in the system, well, it would be unsustainable. So there's this little phenomenon called adverse selection. So the way that our health insurance companies make money is that they avoid risk. They avoid the sick, the unemployed, the poor, and they try to insure the healthy, the employed, and the young, right? Because they don't want to have to actually spend money on healthcare. So with adverse selection, with the public option, they would take anybody. And of course, they would be taking the sick, the unemployed, the poor. And that is unsustainable, because those are the people that need healthcare the most. So you need a large risk pool with the healthy and the wealthy paying into it in order to have funds available for people to use when they need health care. Does everyone understand? So the public option would have failed if it existed within the system that we have right now, because it couldn't compete with the insurance companies that are for profit. So I hope that all makes sense to everyone. So what did we get for $938 billion? That's Obamacare, right? Or PPACA. Well, we got too many risk pools. So the risk pool in itself, if you have one big risk pool, well, that's going to lower your cost right away. Think about if you were buying a present for your professor. Well, the more classmates you got to go in on that present, well, the less that everyone would have to pay, right? So that's the idea of a risk pool. If you have more people, you all pay less. So right now we have private insurance companies. We have Medicare. We have Medi-Cal. We have VA. We have a bunch of different risk pools. And that's not helping with our costs. What else do we get? Well, we got a Medicaid expansion, but there are still gaps. I actually heard that the Children's Health Insurance Program is going to end funding for chronic disease care for poor children because children are healthy. So, you know, it's just still not covering everyone. And you have to be really poor if you're going to get, you know, Medicaid or Medi-Cal in California. Also, we got a private insurance mandate and public subsidies. So basically, that's helping people pay for health insurance. Again, we have all of that money going into the pockets of the for-profit health insurance companies. Okay, so it's going towards profits, not necessarily health. And we got regulation of the private insurance industry. Well, we still don't have premium caps. I mean, maybe they can't deny you for having a pre-existing condition, but they can still charge you 3 times more. So, I mean, if you can't afford it, what's the point of having it? And also they say that the insurance companies have to spend 70% on medical claims. Well, we all know that insurance companies are the king of finding loopholes. So all they have to do is change the definition of a medical claim and they're back in business. So really, we don't have any accountability. And we can see that in the news. You know, you've seen that they're raising the premiums double digits. They're still making billions of dollars in profits. And this specific little news story was about how, in response to the mandates, they dropped the child-only policy plans. And they can do this because they consider these products, right? If they're not going to make a profit, well, they don't have to offer the product. Right now, our healthcare system, our healthcare is a commodity, and patients are consumers. If I want a cell phone, I can go buy one if I have enough money. If I want a really nice one, I can go buy a really nice one if I want to pay more. And that's how we have our healthcare system. But if we believe that healthcare is a right, well, that doesn't really make sense, does it? Okay, so let's look quickly at what are the effects of our system. So right now, the US is ranked number 37 in the world. We're the lowest of any developed nation when it comes to healthcare. This is done by the World Health Organization. It's based on several factors, such as, you know, how many people have access to care, how much does it cost, what's the quality, etc. And I mean, look at some of the countries that are before the US. So you would never have thought that some of these countries would be ranked higher because we're kind of taught that America's the best. Well, we're not the best in healthcare. Okay. Also, we have poor health indicators. So we have the highest infant mortality rates, the highest maternal mortality rates, and the lowest life expectancy of any developed nation. Now, it's not just that we have more mothers or babies dying. These are proven indicators of the public health of the general population. And America is ranked the lowest out of any developed nation. We're not doing well. Also, we have uninsured. We have 50.7 million people uninsured in this country. And, you know, it's kind of an unsustainable cycle. When you don't have insurance, you receive less medical care. When you finally receive it, your illness is much worse. It costs much more. And people die. We have 45,000 people that die every year in America because they don't have health insurance, probably closer to 50,000. That's 150 people a day that die just because they don't have health insurance. And also, I mean, it's kind of a vicious cycle. So you earn less because of poor health. So if you don't have enough money, you can't afford health insurance. So when you actually really So when you go get it, it costs more. Then you have less money. You become poor. If you're sick, you can't work. It's just an unsustainable cycle with being poor and not receiving health care. We also have underinsured. So this is probably the biggest problem in our country. For PPACA or Obamacare, the cheapest plan only covers 60% of your health care costs. So what if you get a bill, you get in a car accident, you have a $100,000 bill, well, you owe $40,000 right now. I don't have $40,000 in the bank. And also, I mean, have you guys heard about McDonald's, the health insurance plan that they offer? So right now, McDonald's offers health insurance to their employees, but it has a $2,000 annual limit. I mean, it's kind of ridiculous. I mean, how much does a Band-Aid? I think a Band-Aid probably costs $2,000 when you're in the ICU, you know? It's like, it's laughable. It's not going to do anything. And people put off needed care because they can't afford it. You know, there are all these statistics that show people put off needed care when they can't afford it. And then this is also a really important slide. So here we have US public spending. Now, the US public spending is more than the total spending of all of these other countries. And on top of that, we spend all of these private dollars. Now, what is this telling us? It's telling us that we have the money in the system to cover everybody. But we're using it poorly. We're wasting it. What are we wasting it on? Administration. We're wasting it on administration and profit. Okay, the insurance companies are making a profit off of pain, suffering, and illness. I'm angry about it. I mean, I hope that you guys are angry about it. And you know, just to compare, Medicare spends about 3% on overhead costs. Okay, it's a lot less money. So how do we cover everyone? Well, we stop wasting all of this money. So what is the solution? How do we get universal health care? Well, these are two acts. HR 676 is the national one. And then SB 810, the California Universal Health Care Act, that's what CAHPS focuses on, obviously, because we're in California. And this is what it covers. I mean, it's pretty much anything that you would need within reason for your health. I mean, including dental. Like, we have 108 million Americans that don't have dental insurance. And people don't realize how strongly connected your overall health is to the health of your teeth. So again, why is single payer better? And how is it going to give us universal health care? Well, again, it's one giant risk pool. So you're going to have costs lowered right off the bat. It's also going to emphasize prevention. So instead of letting people, you know, have an illness that could have been prevented, that gets worse and worse, and then they go to the ER where the ER costs about 5 times more, they just have access to a doctor and it can be stopped. Also, we're going to get rid of the profit for the insurance companies, and we're going to streamline administration. So just instead of all this crazy jumble of finance streams or money streams, we just have one single payer. And also with a single payer, you have purchasing power. So you can negotiate with pharmaceutical companies to get lower drug costs. And also we have fair resource allocation. So since we have this competitive for-profit system, if you have a hospital, you know, here and then another hospital 2 miles away, we'll say this hospital buys this really cool, expensive technology that saves a bunch of lives. Well, this hospital wants to compete, so they're going to buy the same technology. Well, now you have really expensive technology 2 miles apart, same stuff. And then you might go 500 miles before you see it again. So the allocation of these resources is unfair. So that's, you know, economic and health reasons. But I mean, also, as a doctor, I think that you're going into medicine because you care about your patient. You want your patient to be, you know, you want to help your patients. You don't want to be arguing with insurance companies. And then also, I think you want it to be fair for your patients when you see them. Okay, so I also, when you know, we're thinking about how to work on universal payer, or universal health care, single payer, you have to be ready for people to, you know, give you their take on it. And I want you guys to be ready. So here are some of the myths. So myth number 1, it's going to cost too much. So, I mean, I've been telling you reasons why it'll cost less, but here are some real numbers, and this is projected by the Lewin Group. So here you see that, yes, it's going to cost a little more to get rid of cost sharing and cover everybody. But then when you look at all of the cost savings for administrative and profit, well, you see that we actually are going to be saving about 4.3% overall. This is another one. We need to pay high drug prices to fund research and development. So let's just take a look. This is actually from Health, Money, and Fear, Dr. Paul Hochfeld's DVD. He's in the audience, actually. And so we see that they spend about $32 billion on research and development. But they make a lot more on profits. They actually have the second highest profit margin of any industry after banking. And then they spend double that on marketing and administration. So it's not like they're going to totally lose all of their profit. They're just making a lot of profit. So we can negotiate and get some lower prices for everybody. So it's really not funny. It says, I figured if I cut out meals this week, I'll be able to afford this prescription. Take with food. Damn. But this, I mean, this is kind of what happens, and it's sad. This one, I have insurance. I'm happy. Okay, we need to realize that the healthcare crisis is affecting everybody. We have to cover everyone. I mean, we have to see them at the ER. It's just much more expensive that way. And then also, when you don't give access to everyone in your population, well, it puts you at higher risk for epidemics. Because if people don't have access to things like immunizations, well, then they start getting whooping cough, or they start getting mumps. And that can spread to the rest of the population. Also, we have ER misuse and ER crowding. For all of those reasons I talked before. They don't see a doctor, they don't have money until it becomes life-threatening, they go to the ER. Or some people, they just use the ER as, their doctor, because they know that we'll cover it, right? And then also, so how long will you be able to afford it? There are 3 things that health insurance is supposed to do. It's supposed to keep you healthy, it's supposed to get you well when you are sick, and it's supposed to protect you from financial ruin. Well, we know it's not really doing the first 2, right? Because we have poor health indicators. But for the third one, it's not really doing that either, because 60% of people, they go bankrupt in this country every year due to medical costs. And 75% of those people had health insurance. Health insurance isn't protecting anybody from financial ruin. It's like I said before, what if you get hit with a $40,000 bill and you have a mortgage, you were barely making ends meet in the first place? You're going to lose your house, or you're going to have to go bankrupt. This one's my favorite, socialism. Did any of you ever go to public schools? Raise your hand if you went to a public school. Yeah, I went to public schools my whole life. Okay, the desk that you're sitting on, those were subsidized by tax dollars, socialism, right? Did you guys hear about what happened in Tennessee a couple days ago with the firemen? I don't know if you guys went to Bill Skeen's workshop yesterday, you did. But for anyone who didn't, there was a Tennessee man, and they had this weird thing, subscription fire service. And this man didn't pay his money to subscribe for the fire service. His house caught on fire. He called the fire department. They came to the edge of his property and were like, oh, you didn't pay. You didn't pay your fire service subscription. And they watched his house burn to the ground. And that's just like, oh, icky, where are we going as a country if we just let some guy's house burn to the ground? It makes me feel sick. Because we're supposed to have empathy, It's not all about money, I hope. And universal health care is not the enemy of capitalism. There are plenty of capitalistic and democratic nations that have universal health care, single payer. And actually, the fact that we have such high prices in our healthcare system, it actually makes our businesses less competitive in the global market. Okay, so this is another really important fact. AT&T spends $2.4 billion covering their employees. Now, I know it's the right thing to do. It's good for them because they'll attract, better employees when they offer benefits. But what if they're running out of money? What if they're about to go under? Well, under Obamacare, the fine of not offering health insurance would only be $600 million. So $2.4 billion, $600 million, we're going to go under, trying to cut costs. I think I know what's going to happen. And then this one, healthcare will be rationed. Well, right now we ration by who has enough money, right, who has insurance, and Canada. So, everyone's like, oh, there's some lines in Canada for, non-urgent things. Well, at least they have a line that you can get into and you can get to the front, because in America the line's 50.7 million people long and there's no way to get to the front. You know, Canada pays a lot less, they have a lot better health indicators. So whatever their few little problems are, I'd much rather have those problems than the problems that America has. So, how do we know this will work? Well, Medicare, we have a single payer system in our country. It's for people who are over 65. Right? If we expanded Medicare to everyone in the population, that would be a single payer system. We also have the VA. That's like real extreme, government owned, government operated. And the VA has the highest satisfaction rating of any insurance, public or private. 85% of the people in VA are satisfied with it. You're not going to find that in private insurance companies. Also, we have other countries. Okay? Every other developed nation has gone to universal health care. And you know, some people are like, oh, we can't compare ourselves to other countries. Well, it's like, why not? Are we really so special that the same kinds of things don't affect us? Well, I hope not. Every other country has figured it out, you know? And I think it's time for America to take a step back and say, okay, we're spending way too much. We're not getting the benefits from all this money we're spending. What can we learn from other countries? And everyone say, oh, well, you know, how do we know that single-payer universal health care is going to work? Well, the system we have right now isn't proven, and actually it's proving not to work. So, you know. Okay, so now, more concrete things. What can you do about it? You can join the California Health Professional Student Alliance. It's free. You just sign up right here on this little email list, and then I send out the emails, and I swear I don't send out very many, maybe like once every 2 months. I know you guys get a lot of email. And you can also start a CAHPS chapter at your school. We have this nifty little chapter startup packet. This is available at CAHPSA.org. That's CAHPSA.org. You can download that. And also you can attend the CAHPS Conferences. We have a Northern Conference that's coming up October 23rd at UCSF. And there is a flyer here. You guys want to pick that up? And we have a Southern California Conference, and that's at UCLA on November 14th. Okay, the flyer is right here. Also, we have Lobby Day. This is our biggest event. We have about 500 to 600 students come up from all over California for this 2-day event. This year it's on January 9th and 10th. On the 9th, it starts with a conference, and that's at CSU Sacramento. We're going to get a bunch of celebrities this year, hopefully. And we'll talk to you about single payer, you know, give you some tools. And then on the 10th, there's a march through Sacramento to the steps of the Capitol where there's a rally. Senator Mark Leno comes and talks. And then all the students go in and meet with legislators. So this is a really, really good opportunity for you guys to learn how to talk to legislators, how to advocate for something you believe in. I mean, not to mention that you're fighting for single payer, for health care as a human right. Yeah, did you have a question? Have I talked to Senator Elaine Alquist? I haven't personally. I'm not sure if PNHP has. I'm not sure, sorry. But that's probably a good idea. And then also, you guys need to educate yourselves. Okay, there's so much information that I really can't give it all to you in this little, time period. PNHP.org has tons of research that they put out. It was started by 2 Harvard doctors. And also, you guys need to vote. If you believe in something, then, you get people in office who also believe in your same things, and then hopefully they enact the legislation that you want. That's how democracy works, right? So if you don't vote, then your voice isn't going to be heard. And you can advocate for universal health care. You can go to votesmart.org, find out who your representative is, and for state or federal, and talk to them. Tell them, I'm a student, I'm a pre-med student, or you guys are going to get in, right? I'm a medical student, and I want universal health care. I want to protect my patients. And, just in case you guys forgot, there's this whole long process for bills, and you can be advocating for whatever bill you want this whole different way. It has to go through, in California, there's the Assembly and the Senate, right? So whatever house it gets introduced into, Goes through all of those committees, and then it goes to the other house, goes through all of those committees. If there are differences along the way, because they all vote on it, then they have to resolve those differences. It gets passed finally, and then it goes to the governor. And SB 10 has gone to the governor twice before. He vetoed it both times, but it just means we need to get a governor in there who supports universal health care. And in case you're a visual learner, it's a little diagram, how a bill becomes a law. And then also there are tons of organizations that are involved in single payer. All of these organizations, I have all of their websites on my little makeshift business card. Don't laugh, we're a student organization, we don't have any money. And you can work with them. I mean, AMSA supports single payer for the most part, right? And also there's a MAD, the MAD is held doctors. They did this big tour of California, and there's an event tonight at 7:30 at the Congregation Bet Havarim, and that's in Davis. So Dr. Hochfeld is actually one of the MAD is held doctors. If you guys have any questions, you can ask him about it later. And really this is about building a movement. Okay, you guys, I mean, in order for this to work, you have to believe in it. You have to fight for it. You have to talk to your friends and your family about it, right? I mean, that's how things get done. And I mean, less than 100 years ago, women didn't have the right to vote, okay? And people are like, women's rights? No way. But they're like, oh, okay, you're right. Forget it. No, they fought for it. They got arrested for it, They worked on this movement. They held rallies. They did marches. And this, I really, really like this. It says, over the pass of by and by, you go to the valley of never. You guys see what that means? Over the pass of by and by, you go to the valley of never. So you're like, oh, it'll happen sometime. Well, it's never going to happen because you have to work for it. You have to fight for it. All right, that's it. Do you guys have questions? Don't forget to come and sign up for CAPSA. Like I said, it's free. Hope you guys go to the conferences.
Molly, can you just discuss briefly some of the other organizations equivalent to CAPSA across the country? Are there other statewide organizations that students could join or could learn more about, given that we have a national audience represented here, both in the conference itself as well as through the broadcast?
Mm-hmm. Actually, I don't know of any other student group like CAPSA in any other state. There are 22 states right now that are working on single-payer legislation. And California and New York are probably in the forefront of that. And I know there is an executive director of PNHP in New York, and she's looking for student volunteers to help her. There's no one like me, like the sheer student fellow that any other PNHP chapter, state chapter has. But if you want to get involved, PNHP loves having students involved. You can go and get internships at the National PNHP office. I believe it's in Chicago. Or you can just contact the PNHP national office and say, hey, I'm from this state. Can you put me in contact with whatever chapter is here? Or you can just start a chapter in your state. I mean, if they want, they can email me. My email is really easy. It's just Molly, M-O-L-L-Y, at pnhpcalifornia, that's spelled out, .org. Email me. I can help you start your own chapter or get connected with the national office. Any other questions? Yeah?
So from the money pool that you will be pulling out of to pay for this universal health care, would there be new taxes implemented, or where would you get that bulk of money? Or instead of paying it to the different insurance companies, we would just make that, it would just go directly towards the federal fund?
So the question is about the money pool. So first of all, we have 60% of public dollars already in the system. So those would just be reallocated to the single payer. And then we would have a payroll tax, much like the payroll tax that we already have in place, that would also go towards a single payer instead of to several different private insurers or public insurers. And then we would have an income tax, and that would also replace all of your premiums, all of your copays, and all of your deductibles. So, I mean, on average, it actually saves families money. And then this also makes it so that it's more progressive. So right now, poor people pay a higher percentage of their income. It's a regressive, financing system for healthcare. And then now, or under a single payer, it would become progressive because it would be based on your income percentage. Yeah?
So if, let's say, like, we do get universal health care and the government pays for everything, what happens to people who work for the insurance companies? Will they may be losing their jobs, won't they?
Yeah, that's a great question. So he asked, what's going to happen to all the people who are employed by these private insurance companies? So there is language in SB 810 that says that they will help them get retrained. There are going to be jobs available for the single payer. And also right now we have a lot of nurses that work as administrators. They look at charts, they help deny claims or, whatever. And they could actually go back and actually be giving healthcare as a nurse, go back to that sort of job. And also, Australia, when Australia transitioned between their system and a universal healthcare system, they actually made it so not one person lost their job. So there are ways to do it. It's not like this is going to happen overnight. This is going to happen, over a period of a few years, and there'll be time for people to find jobs. Have any other questions?
I wondered, like, has there been any questions about, like, since that America has, like, issues with immigrants coming in and also probably, exploiting our services, has that ever been an issue, like how they can prevent anything like that would happen?
So the question was about immigrants. Where is it? It's almost here.
But isn't it like if you're afraid of immigrants like using the system already, like the people, the illegal or undocumented immigrants, they're already using the system. So they're already they're already calculated into like the whole like negative whatever you want to call it, you know what I mean? Like if I'm illegal and I'm pregnant, like I'm not gonna like give birth at home. I'm obviously gonna use the ER and I'm obviously gonna jet right after, right? So that just makes it, if we have an official system in place, you'll just account for that so that it like you don't get like the hospitals themselves don't get like these like expenditures that they can't like take up and they can't pay their employees, They'll be compensated.
Yeah, so the question was about immigrants. So under SB 810 and CAHPS and PNHP believe that, of course, since healthcare is a human right, that healthcare should be extended to everyone, whether you're documented or not. There are several reasons for this. So she talked about some of the economic reasons. So we have to cover everyone in our population anyway. And if they go to the ER, it's just going to cost us all more, right? So we have to keep that in mind economically. Also, if you don't, from a medical point of view, if you don't cover your whole population, again, you're at risk for epidemics because they don't have access to things like immunizations. And then also, we need to remember that immigrants actually pay a lot more in taxes than they ever receive back in services. So I think it's really important to cover everybody. There are a lot of reasons why: economic, moral, and health-wise. Is there any other questions? Yeah.
So then, I guess if there was universal health care, that means that doctors would be like working for the government, would they, or?
Okay, so yes, if we have universal health care, our doctor is going to be working for the government. Okay, so no, so that's more the UK system. The UK, the doctors are government employees, everything's government owned and operated. Well, in the US, under SB 810 or HR 676, the national bill, the doctors would be private, so it's privately delivered. So hospitals would have to become nonprofit, but doctors would still be private. So if you had a private practice, it would stay the same. And really, it would just, who was paying you would change as a doctor. Yeah.
Has Jerry Brown or Meg Whitman promised to sign any single-payer health bill?
No, they haven't. Sorry, so has Jerry Brown or Meg Whitman promised to sign a health bill? Well, I'm not going to hold my breath for Meg Whitman to promise that. But Jerry Brown, I don't think that anyone's really asked him. So I'm not sure. But no, as far as I know, they haven't come out saying yes or no. Any other questions? Do you have questions from Twitter or anything? Okay. You guys have any other questions? No?
All right. Well, thank you very much, Molly, for sharing some great insights and advice on how to get involved in this really important issue.